My name is Billie Slater. I'm the Innovation Specialist at the Minneapolis VA Healthcare System, and I thank you for inviting me to give my presentation to you at this special valuation competition. I'm talking to you today about a special project I've been working on for the past 3 years with the support of the VHA Innovators Network, the Prosthetic Sock Management Tool. Prosthetic sock? What is that, you may say? Well, we'll get to that in a moment. I would like to begin by telling you a little bit about the amputation situation in the United States. The Amputee Coalition says, it's not uncommon, and it's becoming less uncommon every day. In a single year alone, there are over 185,000 new lower limb amputations in the United States, usually through the bottom portion of the leg, or transtibial, or through the upper portion of the leg, transfemoral. An amputation is usually one of two varieties, traumatic or non-traumatic. Traumatic amputations are due to accidents, car, motorcycle, farm, or lawnmowers. They can also be due to combat injury and gunshot wounds. Non-traumatic amputations can be due to medical conditions such as cancer, diabetes, or vascular disease. They can also be due to limb differences, requiring amputation to permit the use of a prosthesis. Amputations have a cost not only in dollars, but also for the people who experience them. There is a physical as well as psychological price to pay that goes along with the loss of a limb. In 2016 alone, Medicare paid out more than $717 million in expenditures for nearly 2.11 million prosthetic services. Wound-related complications are a large cause of rehospitalizations and post-amputation. We will see how this is related to prosthetic sock management in just a bit. So what can a person expect post-amputation? With good care and rehabilitation services, a person can maximize their mobility as the situation allows and work toward their desired level of participation so they can do the things they desire to do. Acknowledging the importance of pre, post, and rehabilitative care for people having an amputation. In 2017, the VA and DoD together issued revised clinical practice guidelines for rehabilitation for individuals with lower limb amputations. In these guidelines, physical and functional interventions for prosthetic training are to be provided to patients. This includes residual limb management, including the donning and doffing of prosthetic socks. There they are. Now, let's get back to prosthetic socks. Not all people who use a prosthesis also use prosthetic socks, but for those folks who do, these socks play a big role in managing the fit and comfort of the prosthetic socket. Prosthetic socks have similarities with socks for intact feet. They come in different sizes, lengths, and thicknesses, or ply. Please imagine a dress sock, an athletic sock, and a hiking sock. The three socks are analogous to the 1-ply, the 3-ply, and the 5-ply prosthetic sock. The prosthetic sock does not interface directly with the skin, but is applied over a thinner nylon sheath or thicker gel liner. Donning and doffing prosthetic socks is a method of accommodating the fluctuation in residual limb volume that may be a daily occurrence. Because many sockets are rigid and cannot expand and contract as the limb changes volume, socks can be used to provide cushioning, absorb perspiration, and to fill up extra space inside the socket when needed to provide a good and comfortable fit. Likewise, socks can be removed when residual limb size increases to accommodate extra volume. As you can see, the correct use of prosthetic socks is an integral part of residual limb management. So, what happens when the socks are not managed correctly? Well, it's not good. Incorrect prosthetic sock use is something that most prosthetists I've spoken with report seeing daily. It is a serious and persistent problem. What are some consequences of improper socking? Discomfort, wound formation, infection, revision surgery, and repeat amputation. Many people with lower limb amputation have compromised circulation due to diabetes or peripheral artery disease. It may be very difficult for wounds to heal for a person with compromised circulation. The results can be disastrous. So let me tell you about the Prosthetic Sock Management Tool. It is an easy to use, simple to understand, machine washable, two-part educational tool for teaching and reinforcing the proper use of prosthetic socks. It consists of a 3-zippered pouch system and a laminated infographic. The pouch system has 3 zippered pockets, and they are labeled to contain specific ply of socks. The laminated infographic covers 3 important areas, as identified by our clinicians: donning and doffing the correct number of sock ply, performing regular fit and comfort checks throughout the day, not just the end of the day, and a reminder to wash and dry the socks. The PSMT is used by clinicians to perform sock education at many points during the rehabilitation and prosthetic fitting process. It is also a tool for the creation of new positive habits in the post-amputation phase, especially those regarding proper donning and doffing of sock ply as appropriate. It will also support creating the habit of conducting fit and comfort checks throughout the day, and importantly, includes the reminder for cleaning the socks. Clean socks are good socks. In other words, the PSMT helps the person using it to manage their prosthetic socks. I'm happy to report that the PSMT was developed with input from patients and clinicians. The IP for the PSMT is owned by the Department of Veterans Affairs and has passed through the provisional patent stage and is docketed for review with its patent pending. Let me tell you a little about what people have to say. A pilot study of the PSMT was conducted last year. The PSMT was used by the prosthetics resident with a patient who had continued difficult time understanding how to correctly use his prosthetic socks. This patient had a large wound on the bottom of his residual limb caused by wearing too many socks and was unable to wear his prosthesis. The resident used the PSMT for instruction. The patient went home with his new PSMT. After several weeks of using the PSMT, the patient returned to clinic for a checkup of his limb. He said, "I finally understand how to use the socks. The PSMT has changed my life." He kept the infographic on his kitchen table so that when he had his coffee throughout the day, he could review it for what to do with his socks. I look forward to our next data collection. I had the opportunity this past year to be a presenter at multiple assemblies of the prosthetics industry. I spoke with many prosthetics professionals. I heard again and again, "Where can I buy this? Why hasn't this been done before? There is nothing like it on the market." We are looking for a commercial partner to bring this innovative product to market. We ask for your help in making this a reality. Please help us to bring the prosthetic sock management tool to the people who need it the most. Thank you very much for your kind attention.